on our YouTube channel, A Man in White Coat. So today in this video we are going to study about cleft lip. Lip means what? Lip. Cleft means there is an opening or cut in the lip. It can be considered as cleft lip. So as per the definition say, it's a congenital defect. So cleft lip is a congenital defect, means till the starting of the birth, right? Till the from the birth is a congenital defect. Then in which split or the opening of upper lip due to failure of fusion of facial structure during fetal development. So during the fetal development means when the baby is in the womb, that time during the fetal development there is a facial failure in the facial development. So during the fetal development there is a failure in facial development, and because of that there is chances to having split or opening of the upper lip. There will be a split or opening in the upper lip. It will be considered as cleft lip. So hope you understand the definition. So next one is incidence. So first incidence is congenital. So it's a congenital defect. Then it's a common in male. There's a chances of having common. It's a common in male only. Then occur with the cleft palate. So here a condition cleft palate. So cleft lip means deformity, or we can say the split or opening in upper lip. It's cleft lip, and cleft palate means there is an opening in this palate, means above the tongue a palate is there. So there is a split or opening in this palate is considered as cleft palate. So these are the incidents. Etiology. So what is the causes? Our first cause is genetic factor. So it's a genetic factor because of the genes. If the parents have, the baby will also will suffer from the same problem. Then the family history. So suppose it's in a family history by either in maternal side or the paternal side, so the chances to having the cleft lip. Then environmental factor. Then the maternal malnutrition, smoking, alcohol, or during the intake, the pregnancy or infection. So suppose mother is pregnant and she is using alcohol, having smoking, or she is suffering from any infection, so there is a chances to having deformity in the fetal growth. Suppose mother is pregnant and she is doing smoking, alcoholism, and other thing, using the drugs, or so the chances to having the cleft lip is more and more during the pregnancy and because of the behavior or the malnutrition of the mother. Then the type. So basically there is a two type, unilateral and bilateral. Uni means one and bi means two. So unilateral means one side. Suppose here is only one side opening in the lip, so unilateral, and suppose is there both side, so it can be considered as a bilateral opening or the bilateral cleft lip. Then is a complete and incomplete on the basis of the severity. Suppose it's a completely open or the incomplete open, so it's based on the severity. Then the clinical features. How we can recognize clinical manifestations? Of course, in a visual gap in the upper lip. So visually, by the just for the observation, we can see that he is suffering from this cleft lip. Then the feeding and sucking. So there is a problem in feeding also and sucking. Suppose there is an opening of baby is having suffering to feed anything or having problem during sucking anything. Then recurrent effect infection. So because of this, because of that cleft lip having the chances of infection or recurrent again and again is suffering from the infection. So these are the clinical features. So now diagnosis means diagnostic evaluation. So first one is parental prenatal USG. Prenatal ultrasound means when the baby is in the womb, so that time just a mother had to perform ultrasound to check the how the baby is in the womb. Then physical examination at the birth. So physical examination at the birth time by just for the observation of physical examination, automatic nurse can visualize that he is suffering from cleft lip. Then management. So main management is Chiloplasty. Main management is chiloplasty. So chiloplasty is the surgery of upper lip, can be considered as chiloplasty. So nursing management means there is a two type of nursing, three type maybe before the surgery, after the surgery, and during the surgery. There is a three type of nursing management. The first one is, it means pre-operative, excess feeding difficulty. So nurse will be access the how much is suffering from, means how is suffering or how difficulty he is having during the feeding. And because the surgery is always started at the 3 month, here I already done around 3 months of the age. So a nurse will identify the difficulty of feeding, and the nurse will use the technique of feeding like drop technique and the spoon technique. Then the post-operative management, maintain airway, maintain hygiene, and educate the parents about that, how to maintain the hygiene and all the things, and how means when to come, when to meet again to doctor for the follow-up care. So these are the management. So hope you understand the meaning of cleft lip. Means split or the opening one side or the both side in the lip. It's a congenital defect, and it's always occur during the fetal, means facial during the fetal development. So thank you for watching this video till then. Jai Hind.